Thursday afternoon to talk about what's going on in self-sufficiency programs and also to hear your input. So I do hope you take this time to speak up. And I'll say that on our agenda is our self-sufficiency director, Claire Sequin, but she's not here yet. So we're going to see.
She's here.
Why,
She's under
yes, I am.
Mackenzie.
Oh, I see. No wonder. Cleverly hidden.
Well, not intentionally. I don't even know how that happens. How does that happen?
I think somehow you got a different link or something, but it's good to see you, Claire.
Must have. Yes. So I'm ready whenever you are. So just let me know.
Okay, well, I don't think we need any further ado. Then I'll turn it over to you, Claire.
Well, thank you, James. It's nice to see you too. Hope everybody is not slipping and sliding too much and staying warm and all those things. I'm here in Eugene and I'm watching the snow melt. It was beautiful this morning and now it's just kind of a slushy mess down here. So I'm going to talk to you just a little bit about what's happening in the ledge session from the SSP point of view. And I'm going to start off just by sharing that this year, I've done a few sessions now, and this year we actually are going to have 4 presentations to the Ways and Means folks. So for SSP, we're going to be doing an overview. We're going to do a presentation on TANF. We're likely going to do one on SNAP, and we're going to do one on refugee. So lots of airtime coming up for great work happening in SSP and looking at budgets and all the things. So that's kind of exciting. We're tentatively queued up for the first half of March, let's say. No dates and times specific yet, but they'll all be noticed appropriately when we're on. We're the first part of the agency to present. So I'm excited about all of that. A lot of great things to share. As far as ledge session goes, we know that over 2,800 bills dropped initially. It's a lot of activity, lots of sorting, lots of pricing, lots of trying to move things along. So that's kept everybody really, really busy. We're having some meetings with some legislators to sort of talk through the POPs that we have and some of the other issues that are coming up. So just generally, all of that is underway. We know that this is a marathon, not a sprint. And we also have the federal climate sort of overhanging everything that we're doing. So there's just a lot of thinking going on, a lot of planning happening in SSP. Really trying to stay abreast of what we're hearing trend-wise, especially from our federal folks about TANF, SNAP, some of the biggies that we know are being have a little bit of a spotlight shining on them right now through reconciliation and whatnot. So we're very alert and we're very planful at the moment with lots of things. But let's see, out of the bills that have come through, there are a few that we wanted to highlight for you, as well as just sort of call out our POPs and related bills. So we'll talk food first. So many of you probably are well aware of SB 611. It's the Food for All bill that's sponsored by Senator Campos. And it's really a repeat bill from last long session that would provide SNAP benefits for those eligible, except due to immigration status. And so the initial costs for the bill are pretty substantial. And we knew that from the last go round. And the senator and the advocates who are working on this are really looking at potential ways to decrease the cost by focusing on maybe targeted age ranges as a solution, such as youth or maybe older adults, that sort of thing. There's a Senate Bill 64 that requires our department to seek a waiver of federal requirements in the Supplemental Nutrition Assistance Program, SNAP, in order to allow recipients of SNAP to receive advance installment payments of the tax credit for dependent care expenses. A similar bill has been proposed twice, and FNS has denied this request each time. So some of you have been probably tracking that one, and we'll keep asking. And then we have our ESAP POP, which is the Elderly Simplified Application POP, and this particular policy would ease the burdens on older adults in Oregon and those with disabilities in accessing their SNAP benefits. It would include a 2-page simplified application, and it would extend the certification period for 36 months, which would be great, and would reduce the administrative burdens for those particular populations. And it also would include some systems change costs and 2 FTE. So really big plus for the folks we want to serve, and a little bit of cost on the back end, but the POP is in, and discussion is happening. So that's exciting. On the economic support side of the SSP universe, there's HB 2991, which is about the tax infrastructure expansion. And what that one does is that it appropriates money to be used for funding outreach regarding the federal EITC, earned income tax credits, and other tax type benefits to provide tax navigation and preparation to low income individuals. We are constantly on the quest to bring those dollars to Oregon. And so this is a bill that would bolster the tax infrastructure grant program here. We, of course, as I'm sure many of you do, we believe it's critical to ensure that free tax preparation services are made available statewide for low income folks so that they can take advantage of the tax credits that are available to them. This bill at this point might be amended to 20 million, 10 million in additional funding, but we're not really sure where that one's going to land. But just as a heads up, that relates to our tax infrastructure program. Then, of course, we have the whole array of funding that supports the Youth Experiencing Homelessness program. So we have a POP to try to ensure that the core services that we have built with the last few biennia investments maintain whole as the core service delivery. So this is included in the governor's budget. And it's asking for just under 20 million to make one-time investments from the 2023 session permanent. So this is basically to shore up the core services in the YEP program that we've seen such great results from. Then there's also HB 3079, which requires DHS to update its 2022 estimate of costs to the implementation of youth experiencing homelessness programs. And this has been brought forward by the advocates who've recently amended this bill to include mental health service supports. So that's interesting. This bill would have an impact on YEP and a potential funding and staffing increase if it were to pass. It requires an update to a previous study in addition to some internal analysis and some joint reporting on allocating a portion of the large agency budgets for youth programs. So we're hopeful about that one. We all, I think, can share some pride and some excitement about the work that's happened in the last few years from our Youth Experiencing Homelessness program work. Some really incredible pilot work around cash, benefits, and all of those things. So very excited about that. Then we have the whole immigrant and refugee program area. We will be doing a full presentation on our refugee programs. And as you can imagine, this is another area where SSP has been spending a lot of behind the scenes times just generally working through the executive orders and all of those sorts of things. And I feel completely proud that we are in a state where we have the sanctuary designation and where there's such support for maintaining the integrity of these programs and for the support and welcoming of all folks to Oregon. So I'm excited to be here and glad to know that there's some interest in any number of bills around the refugee supports. So let's see, there are several bills that are out there to repeal the sanctuary state status. We don't really know exactly how those are going to go, but HB 2191, HB 2192, and HB 3551 are all about repealing the sanctuary status. HB 2586 permits an asylum seeker who's a student at a public university in the state to receive an exemption from non-residential tuition and fees. SB 476 is a degree accreditation bill sponsored by Senator Jama. And it's another bill that's a repeat from the 2023 session that seems to have broad bipartisan support. It would allocate about $10 million to the refugee program to grant to eligible agencies. And it requires professional licensing boards to provide culturally responsive training to specific or to specified staff members and to publish guidance on pathways to professional authorization for internationally educated individuals. So that's got some interesting potential. And then there's been a lot of conversation about extended case management expansion. This is already a part of our current service array in the refugee program. So the Welcoming Refugees Bill that was initially passed in 2019 to help resettlement agencies withstand some of the funding cuts that were happening during the first Trump administration. This funding came into play then. And due to the current cuts, as well as the significant increase in refugee arrivals, the Office of Immigrant and Refugee Advancement and the Refugee Program and the resettlement agencies have all proposed expanding this funding to better meet the current needs. The bill was submitted just now by Senator Jama this week, and we're expecting it to drop shortly. So there'll be more details about that once it's formally dropped. But we've seen the benefits of the extended case management infrastructure that's been built over the last few years, and we absolutely know that more is needed in order to maintain the services that the folks who are here need. So we're very much behind that. Let's see, as it relates to children and families, if you all haven't heard the phrase momnibus bill yet, that's sort of a fun phrase for a bill that Senator Reynolds has been working on to pilot a program in partnership with OHA that would provide housing benefits for pregnant mothers. It would also stack on top of the 1115 waiver housing benefit. So to take advantage of that, there will be a work group that's going to discuss eligibility, payment methods, and other logistical details. So a draft was sent to Reynolds this week, and the bill also will be dropping shortly. So lots of work behind the scenes on that one, getting ready to be dropped. Let's see, then we have lastly HB 2374 about chronic absenteeism. And this requires ODHS to establish parenting effectiveness programs and award grants to local and community entities to provide services for students who are chronically absent. Impact to ODHS if this bill is adopted, but we've seen positive outcomes on chronic absenteeism with our school-based family coaches. So some of you who worked with us for a while know that we have various populations that we have worked with our family coaches sort of targeting, and schools have been one, and we're beginning now to get the data in that really demonstrate the effectiveness of that kind of focused approach and knowledge creation around whether it's refugees or students or what have you. We know that special emphasis is really productive and very helpful coming from our family coach teams. So we're really excited about the possibilities there. So those are my updates. I know it was kind of fast. We can share a lot of this in these in a written format if that's helpful. I'll ask our GR team to put that together so that you can have it. And was that face, James, because it wasn't that fast?
No,
Or was it
it
too
was
fast?
fast. I was just like, we'll need a written format though,
Yeah,
because it's
absolutely.
hard to get help verbally.
Absolutely. Yeah. But are there any questions about anything in particular? I mean, what we could be excited about is that there's some food bills, there's some economic support bills, there's some youth homelessness bills, refugee bills, and children and family support. So I'm loving all those topics an awful lot. So excited to have those conversations at the legislature in a meaningful way to try to garner some investment.
And not to take over the whole meeting with, but I would love to hear from our partners certain bills that you think this space should know about as well. Or if you wanted to get a number of one of the bills that Claire's mentioned, again, anything like that. And this is where I ask another question that I can't think of, but just to fill the space to give you time to think of to answer the other two questions I asked.
Thanks for the report back, Claire. This is David Whelan with Partners Stronger Free Oregon. Um,
Hi.
maybe I'll highlight one bill that we're working on that folks might be interested in and ask a question. The first one would be school meals for all. It's House Bill 3435, extending free breakfast and lunch to every public school student in the state. We'd love to have your support and interest, and I'll put some links in the chat there. Uh, I'm curious about any funding or changes or acts around summer EBT coming from ODHS.
We don't have anything specifically new about summer EBT except what's already in our budget to continue the program as long as the feds will have it. We
I
definitely plan on carrying it forward. So
wanted to
we've
jump
done
in
other
there,
things.
if that's okay with you, Claire.
Yeah, yeah.
David, thank you for bringing up that House bill. I know that we're keeping an eye on that one too, because that would it would be a benefit, of course, to families and students specifically in school. But no, nothing on the summer EBT front as far as it's permanently funded. Things are going well, but nothing we're keeping too close of an eye on the legislative end.
Anyone else?
Anything SSP related in general that's not legislative in nature. I'm here or message me or what have you.
Yeah,
Always available.
you've got the director here.
I tried waiting a bit and see if anyone else would come off. This is David Wheeland again. Um, maybe it's just a plug for what might be helpful in the future from SSP programs in this space. I mean, I think all of us are getting questions and interest and fear and uncertainty around program availability, eligibility, particularly around immigrants, uh, immigrant Oregonians accessing these resources. Would love to be able to have a bigger conversation with ODHS staff and particularly the partners in this space who are hearing directly, as you all are, from folks who are navigating the sort of perception of state programs and their availability and the yeah, I know none of us have all the answers that we want right now, but I think this might be a good space to have a future conversation about that sort
That
of
sounds great.
spanning programs in particular.
Yeah, we'd be happy to put that on the docket for sure.
Beth, I see your question in the chat. How many immigrants drop SNAP coverage voluntarily? We don't have those numbers. I was just asked by a different partner to get enrollment numbers for SNAP in general to see if there's any trends. That's something I'm going to be digging up in the next today and tomorrow. But I don't think we can know if someone is dropping because they're moving out of state or because they decided to drop voluntarily or out of fear or anything like that. So we'll just look at the trends. I've like you, probably not as much as you, but I've heard anecdotal stories of people dropping like health coverage out of fear of things that are going on. I'll just say that for us right now, nothing has changed. We are delivering services as well as we can.
And trying to do communication strategies as well. I mean, to try to reassure folks and all of that. doing some of that as well, social media, other things to try hard. We, as far as the refugee work goes, so to be really specific about that, we have some pretty major regular monthly meetings with all of our CBOs, our community-based organization partners, and our resettlement agencies to talk about what's really happening on the ground. And as you can imagine, there's a lot of information, a lot of concern, fear, looking for resources, scanning the environment, just kind of generally. But I think we'd be happy to come talk about that a little bit, if that in particular interests you as well, David. Just because I think we have a lot of ears to the ground on that work. It's harder in the other areas. We're looking, of course, at caseloads generally, and they're staying about the same, if not dropping just a little bit in some of our program areas. But it's hard for us to dissect it to know what that's really saying about voluntary drops and that sort of thing. Beth, to your point.
It's always really hard. Like there's no great way of like you'll never get a perfect number, but I think it's really helpful if you do track the trends. And I can imagine one way of figuring out, or at least making some connections, is SNAP cases that are dropped when there are mixed status. Like not everybody in the household group is actually in the benefit group. That's an example of like a mixed status family who might be that you could make a connection that people might be dropping out of fear of immigration consequences. But I did also just want to say we at Oregon Law Center, we have a newly developed public charge fact sheet. I will distribute it as soon as it's up on our website, which is supposed to be really soon. I guess I can just give you copies of it, but I would really encourage the local DHS self-sufficiency offices and your website to really acknowledge fear and really to make it as clear as possible that SNAP benefits aren't even considered in a public charge test, so people really don't have to worry about getting SNAP benefits and basically all the food benefits, at least at this point. So just like being really upfront about that would probably be helpful.
Yeah, thank you, Beth. Let's see. I know OHA has a good document on public charge. It's been up for a little while, and again, nothing has changed currently. We don't know what the future brings, but we can tell people that in the case of public charge, it'll take time. Even if things go terribly wrong, it still takes time, and so we'll let you know. But right now, nothing has changed. And Annie, thanks for that shout out for Beth there. All right. Well, I'm going to thank Claire. You're welcome to stay, of course, but I'm going to go ahead and give a little presentation on the one system. And as you think of questions and percolate with them, you can put them in the chat. You can email us, things like that, and we'll do our best to get you good responses. But yeah, this is just sort of an overview of some of the work that's going on within Oregon Eligibility Partnership. And so I share my screen, get my screen set up. Just set, there's a title card, and here's some of the things I want to talk about. But I'm going to go ahead and roll on through here and just review the basics. When people are wanting to apply or know more about what the status of their benefits are, they can do it online through online portal. They can also visit one of the many offices around the state and they can call. And I just heard right before this meeting, by the way, when we talk about calling, is the EBT replacement line for SNAP cards and for TANF. They are closed today because they had a power outage with the weather. Hopefully they'll be reopened soon. But if you call, you'll hear a message that says, that there's power outage and that they will encourage people to visit their local offices to get replacement EBT cards. Just wanted to mention that since that's something I just heard recently. But when people do call, we've been worried about, we don't have the staffing levels that we want or that are described in our workforce plan. But right now, as of last week, I shouldn't say right now, as of last week, the average wait time for an eligibility worker was 12 minutes. Just to when that first person you talk to figure out, who can help you, direct you to where you need to go, the support staff, that's the average time is 4 minutes. And again, if you call earlier, wait times tend to be less. If you call later, they tend to be more in the day. And if you wanted to really dig into those numbers, we actually have a pretty good set of numbers. And you can try that QR code, or you could just go to this link that I'm putting in the chat. Whoops, and I should show the slide that has the QR code. Sorry about that. So, and also as a bit of a reminder, if you go to benefits.oregon.gov, there are various resources available to you and to your clients to help them get the services they need. All right, now I'm going to go ahead and talk about a new medical program that I hope will be of interest to you and people you work with. That's the Young Adults with Special Healthcare Needs. WISHN, I think, is the way it's been thrown around within the agencies. But this has already started, so I'm just going to run through it relatively quickly. But it is filling a gap because 1 in 5 children under the age of 18 have a special healthcare need. And so this is filling that gap for as they become adults. And for young adults, 19 to 25, as you can see, they do, if they're living with some of these conditions, and they also have to meet the income levels of 205% of the poverty level or below. Now, and I understand that when this was originally announced, it was actually a higher income level, so that's something to be aware of. But this will hopefully help a lot of people around the state. And I said it started January 1st. Well, there's always a catch. I said for 1925, those 19 and 20-year-olds are going to start being eligible, and then they'll continue to be eligible as the program expands to its full enrollment. So there was your quick run through WISHN. I can go into some more details, but I know we have other things to cover as well. That's where I pause for a moment. All right. Some of the upcoming system changes that we have. And I'll start with that first one, the upper left. There's more notice languages coming. There's so many of the paper notices that go out or text messages. There's, I should know this off the top of my head, but I think there's about 8 languages that we have for these notices. But Arabic was added in January, and you can see there's several languages that are going to be coming in March. And what this means is like 80% of the notices that go out are just, like 20 different notices, and they're all getting translate into these languages. So we're pretty excited about this, and this is going to continue for numerous more languages in the coming months. And we will eventually be getting almost 100 languages for these notices. And I'm going to take a moment to, you got an extra email yesterday about the Marshallese SNAP renewal notice. Well, as I pointed out, as was pointed out in the email, unfortunately, that was only for SNAP renewals. The full paper application, for medical, food, cash, and childcare programs is available currently in 8 languages, but we will get Chuckies and Marshallese as per requests we've seen in that as well. So, all right. So there's that coming along. We also have, there's certain people who, for various reasons, want to get their notices in audio form. And we've been sending out cassette tapes, which, is breaking new 21st century technology. And I don't know about you, but the last few cassette players in my house are slowly breaking down. So we will be able to send audio files and CDs to people who are requesting their notices to be in a verbal format. So just one of the little things that I just wanted to mention. Probably a bigger thing that's coming March 12th is the addition of more questions in the application. Now, this is from an Oregon law that was passed, I forget when, a few years ago, that's requesting that we collect information about sexual identity and gender identity. And so it's, in addition, there'll be more questions about race, ethnicity, and tribal affiliation. Now, I just want to stress, I'll take this moment now so there's going to be a bunch of other questions, and I can show you what it'll look like if you want. But these are optional questions. We understand there is a little bit of nervousness out there about having even a state government database with this kind of information about a person, but it does help us target our services, and it is a request from the legislature. So that is coming. It's, they're set up. It's going to be launched come next month. All right. And I'm just going to keep rolling here. One of the changes, oh, that's good to see, Catherine, about the summer EBT applications too. Thanks for putting that in. So, SNAP has 1 year of eligibility, and there's 6-month renewals, periodic reports. But I'm happy to say most of the healthcare programs, not all, but most, are going to a 2-year enrollment period. And this information on the slide too is talking about, the end of the public health emergency unwinding, and how people will not have as much time they've had during this public health emergency to renew their health care. It's now back to where it was, normal 30-day timelines. And then if someone loses their benefits, they have 90 days that they can say, hey, please turn it back on, without having to go through the application process. But what's cool is they'll have 2-year enrollment periods. But right now, the way it stands is that means we'll have tons of renewals 1 year and hardly any the next year. And so with approval from CMS, we're going to be spreading out the renewal periods. And the exact process is still to be determined. But no one's renewal period is going to get shrunk. It's going to get extended, though, is how this is working. So that's something that's coming as well. And I'm assuming I can see if someone raises their hand, but do that, or put something in the chat and I'll try and keep an eye out for it. Now, I'm happy to also share, I don't think I've done it in this space, a new external web page. It's new. I'm happy to take any comments or suggestions, but here it is. It's there is a self-sufficiency page that has a lot of great information, and I assume that this group will mostly want to go there, but there is some how-to videos, how to use the mobile app, how to use how to navigate the one system. Hoping to get more materials on there. This screenshot there is just the very top. There's various web links. So take a look. If you feel like there should be some other materials, let me know. And I'll try to get them on the page. And when it comes to ways to connect, I'll put a plug in for a couple different items. And that are a couple of meetings that I host. One is the quarterly one partner engagement. Now, I used to call this the one office hour, where maybe we present for 5 minutes and then just open up for questions. And if there was no questions, then we ended early. But I like to see this as a time where people who do work with clients to help them enroll, and maybe they're like, what? Maybe you get stuck at a certain part of the one application. And I know medical assisters have their trainings to help people, but everyone else doesn't have a lot. So this is a time to come and talk to experts in the one system and with policy experts and say, hey, we're having trouble with this part of the application. What's going on here? What should we do? And part of it is to hear suggestions. And this takes me to the other meeting that I'm hosting. And by the way, before I move on to the second part of this slide, the next quarterly one partner engagement meeting is in March. I didn't write down the date. I think it's mid to late March. So let me know if you're interested. I'll send you the calendar invite. But this one online improvement committee, I haven't talked about as much here, but we've been chugging along for the last year and a half, where we take suggestions from people, from you, from whoever. It's like, boy, it's hard to navigate this page, or things like that. And if and we have a form, and here it is. These we take these suggestions and we take a look. Now, of course, some of them are just like, yeah, that's against the law, or some of them are duplicates of things that we're already working on. But if you do send a suggestion, I'll get back to you and let you know the status of what's going on. And then this committee is going to analyze it, wordsmith it, and put it in. Now, if it's a smaller thing, we can usually get those in place in a few months, which, it's government. That's lightning speed. If it's a bigger thing, well, there is a big backlog of big changes in the one system right now. I probably don't need to go into all the different things that are going on, especially the medical side. And so that's not happening anytime soon. We're talking a couple of years, but nonetheless, it's good to get those ideas in. It helps move the conversation forward. And so please take a look at that form that I just put in, and make your suggestions. And if you have questions, again, contact me. So be happy to work with any of you in confusing parts or anything like that. And so I mentioned this committee too, to give a little bit of the background. It's made up of, right now, we've got 11 people, some medical sisters, an early learning hub, a couple people who receive benefits, and a few others. And we talk about these things, and we try to make it work better, make the one system work better for people. And if that's something that sounds interesting to you, then I'd love to talk to you. If that's something that you think you could devote a couple hours a month to, and you are working with people in the one system, or you know someone who you think would be a good addition, I would love to talk to them because 11 people is a good group, but I'd love to get a couple more people. So um, there you go. Now, I did have a little section on our legislative update. I don't have any bills here, but I just wanted to point out one thing, as Claire said, there's presentations coming up and they'll be in mid-March. Part of our presentation is going to be about how caseloads are still high. I need to look up the SNAP data to see how that's trended in the last few weeks. But we'll say according to our workload model, we're only at 55% of the needed staff. So things are always just plugging along. And we have SNAP corrective action plans in place. Our error rate has gotten a lot better, still needs to get better, according to the feds. And overall, not in the last few months, but overall, the caseloads have gone up over the last 5 years quite a bit. As you can see, the medical caseload has grown pretty dramatically. But that is my presentation that I wanted to give you all. And I want to pause to see if there's any questions. I know it's always tough to just hear someone talk at you, but any thoughts? Because our next speaker is here too. And I know it wasn't on the agenda, but we're going to talk about an upcoming opportunity. I have done that thing I fear the most, and I've stunned people into silence. But thank you, Gabby. We're working on it. It's still relatively new, the one system. It's still we're working out the kinks and everything. But in any case, on camera is Stacy Mahler with I was just going to say, here it is, with the Family First team here within ODHS to talk about some great housing training opportunities. So Stacy, I'm going to turn it over to you.
Hi, I'm Stacy, she, her pronouns. I am working on housing barriers statewide, and we all know that that's a monumentous task. But so things like trainings are small ways in which I hope that I can make a difference. So me and some of my coworkers, I don't really have a team that's directed to housing within Family First, but I work with folks on a couple different teams on housing, and we have been working on bringing some training. So the first one is coming up in March. It is March 19th, and it's brought to us by the Fair Housing Council. And the Fair Housing Council of Oregon has tons of good information on their site. They have trainings there. They have informational flyers there. They have, just information for people. And they do some, catered training specifically to audiences that need it. And so we asked them to do a training and highlighting some specific things, that areas in which we think are a need. Maybe can't cover everything because it's a huge thing, but and we don't want to make it a day-long training. It will be a 2-hour training. Some of the things they hope to cover are areas about rights and discrimination in housing, and specifically in areas of how renters cannot discriminate in cases of domestic violence or disability as a protected class, or and different things like that. And so really the hope is to invite as many DHS folks that are interested in that to come, as well as our partners, because I think we all play a role in that. I think that housing is such a huge issue, not only in Oregon, but across the country. And I think any additional guidance is helpful. So I would love people to come. I don't know if you want to throw that link in the chat or you want me to, but there is a link to sign up. And at the end of that training, there will be an opportunity to give some feedback on what you want prioritized for future trainings. Because so I think the chat still has the old possible date in it. The correct date is the second date, the 3/19. Just so everyone's aware, those were the two times we were considering, and 3/19 was the one that was chosen. So we would love to hear feedback about more things that people would like to learn. Again, I think it's it's important for everybody. I think lots of us probably have experiences in our personal life that we could use this information for. So I really hope that some of you can come. Oh, and I don't think I said it will be recorded. So if you happen to miss it, there will be availability to see it later. It will be linked both in our workday, and it also should be on the Fair Housing Council's website. So you will have multiple opportunities, and they may very well come back to do a secondary training as well, as they have indicated that they have the ability to do that. So I appreciate your time. Let me know if you have any questions.
Well, Stacy, thanks for coming in short notice to give that announcement. Any questions about this housing presentation?
I actually do have a really quick question. I clicked on one of the links and it says for ODHS staff. So I just wanted to clarify that this is for partners or for staff.
It is absolutely for partners as well. Yeah.
Thank you.
We talked about that. I don't know why they didn't get that in there, but it is absolutely for partners as well. That was always the intent. We understand that nothing can be done without our partners. So this is a shared responsibility, and we welcome everybody.
Well, great. We have a couple minutes left, so I'm going to talk a little bit while you think of other questions you might ask or other ideas for subsequent topics for this space. But you will notice also on camera with me today is Catherine Garland, who has been doing wonderful work with the summer EBT program, who is also going to be helping now with this meeting. Catherine, I'm going to put you on the spot. Anything you want to say?
You know, I always have something to say. Thank you, James. I just wanted to say hi. I know some folks on this meeting from different spaces. I worked locally as a community partnership coordinator doing local outreach in the Roseburg area for ODHS for a while, then moved into a summer EBT outreach space. So I know a couple partners on this call from that space. So excited to support and help out in any way that I can. I'm going to throw my email in the chat too. So if there's any suggestions or ideas for future meetings, feel free to send them my way. But we're still working out what that's going to look like with my support in this space, but excited to be here. So thank you all, and thanks, James.
Thank you, Catherine. And I'll also take a moment just to call out another person, Susan Boehm, who's here in the call. I know at least she's attended some of these OEP engagement meetings where we talk about the one system and ask questions. And Susan, I don't know, now that you came on camera, if you have anything to say about those meetings. Or whatever.
Nothing like being put on the spot. I've attended a few of those one meetings. I think they're very helpful. I haven't attended any recently, maybe. I'm not sure when the most recent one was. But yeah, they're very worthwhile. If you are helping someone sign up for SNAP benefits, they're very helpful.
And I will say I did not pay Susan for that comment. But yeah, we moved them to quarterly, just to because there wasn't a ton of questions each month. So, but I think that'll be a good cadence. So that that is our meeting. Again, if you have other ideas, feel free to reach out to us. And thank you so much for your work. Your communities need you. We need you to be reaching those communities. And please don't hesitate to reach out if you have questions.